I think I share with a lot of folks who are joining us tonight a frustration that despite big Democratic majorities in the General Assembly, we haven't made more progress as a state. Governor Hogan's been a real obstacle to that. We need a Democratic governor. But if we're honest, the General Assembly also often needs not just a partner, but a push on core progressive issues. We should have universal affordable child care in Maryland. We should have universal health care in Maryland. We should be treating housing as a human right and ensuring the supply of affordable housing that folks need. We should have paid family leave. The General Assembly just passed it, but left it up to the next governor to figure out all the details. Michelle and I will make sure we deliver on paid family leave. We'll make sure we deliver on reproductive freedom. We'll make sure that we deliver on a vision for public safety that isn't just about policing, but it's actually about healthy communities where police respect people's civil rights and where we invest in mental health services, addiction treatment, reentry programs, and achieve true public safety. So I'm excited for tonight's conversation. I know we're going to range over a broad array of policy areas. And then, as Chrissy pointed out, we're doing an event with Sunrise right after this, where I know we'll get to dive into climate in more detail. So just excited to be here and excited to partner with you all to change Maryland for the better.
Yeah, John, we're glad that you're here too. This is Sheila Bryant. I'm a community activist and general hellraiser. We're glad that you and Michelle could join us. And we're gonna, you brought up a lot of wonderful topics just now. And what we want to do in this time that you've given us is to get a little deeper. Let's let some members of the community, some experts in some of these areas, find out what's really going on and what's on your mind. So first up, we're going to have Jared Scheiblen. He's the chair of the Lower Shore Progressive Caucus, and he's going to have a conversation about a lot of things, and hopefully he'll answer some of the questions that are in the audience. So take it away, Jared.
Well, thank you all for having me. For those of you who don't know me, my name's right on the screen. I just want to start by thanking John for coming out tonight and being a champion for the Eastern Shore. My first question, Mr. King, is what is your plan to address housing? We have a high homelessness rates around the state. We have a lack of affordable housing. How will you address that as governor?
Yeah, well, look, housing is a huge challenge. And, the starting value for me is to say that clearly housing is a human right. And so we've got to organize our politics to deliver on that. Three core things I think we need to do. One, we need to make it easier to build multi-family housing, particularly near transit hubs, whether that's bus hubs in more rural parts of the state or light rail hubs, metro stops, MARC stops. We're going to make it easier to build multi-family housing, and we have to dismantle exclusionary zoning, which has its roots in the history of redlining and racist segregation policies. So that's the first thing. We have to make sure that we are building the housing that we need. Second, we need to invest in our housing trust fund so that we're investing directly in affordable housing. In DC, in the year before COVID, they put nearly $200 million into their housing trust fund to invest specifically in creating a supply of affordable housing. In Maryland, from the mid-90s through the 20-teens, we only put $50 million into our housing trust fund. DC is a tenth our size, $200 million a year. We put in like $50 million over a nearly 20-year period. So we have not been making the investment we should in the creation of affordable housing. We have to do that, including Vaughn Stewart had a bill on social housing, right? Direct public investment in creating housing, particularly for seniors, folks with disabilities. We have an opportunity for direct public investment in housing. And third, we need tenant protections. It took a huge struggle to get the General Assembly to pass right to counsel in eviction hearings. Then it took a huge struggle to get them to fund it for the short term. We need to permanently fund right to counsel in eviction hearings. We have to adopt just cause evictions so that people are not evicted frivolously by landlords. We need to make sure that we raise the eviction filing fee, which is $15 in Maryland, where there's the national average is like $120. So we have to say that we're going to put the government on the side of helping people stay in their homes. And so those tenant protections are a crucial part of a vision for affordable housing. On the Eastern Shore, I'll just say in particular, I look at what Mayor Day is hoping to accomplish in Salisbury and the vision of trying to build more housing near downtown with cultural activities and retail that folks can walk to. That's the kind of vision of the supply of housing that we need.
Thank you for that. My next question is, with inflation being so high and affecting prices and everyday thing for working people, how can we make sure we have livable wages with inflation and everything else going on in the world today?
Well, Michelle, who I introduced earlier, my running mate, was a key leader in the fight for 15 and in advocating for that in the Maryland General Assembly. We should move, I think, immediately to $15 minimum wage throughout the state. We should do that in 2023. And we should index the minimum wage to inflation so that the minimum wage is moving up. Because what's happened in the past is you have an increase in the minimum wage, then nothing happens for 20 years, and you lose the progress that you made when the minimum wage was raised. So we got to index it to inflation. And then we got to tackle the costs in people's lives. Housing, childcare. There are a lot of folks struggling to afford childcare. Michelle and I have a plan for how we could cap the cost of childcare at 7% of a family's income by making public investment in childcare. Higher education. We should freeze tuition across the University of Maryland system. We should make community college tuition free. We should make the first 2 years at one of our 4 HBCUs tuition free, because higher education is a public good. People shouldn't feel like they're forced to choose between higher education and being able to stay in their home. Prescription drugs. It's another place where the state could lead and make sure that we keep the costs of prescription drugs manageable for folks. This, at the end of the day, inflation is a problem because of the impact it has in people's day-to-day lives and their ability to pay for the things they need. But government could play a much bigger role in making sure that we get folks the things that they need.
My last question, I'm sure you get this all the time, is there's a lot of undecided voters, they might be saying to you, John, you have a wonderful platform, but how do you pay for it?
Yeah, I love this question, particularly because we've been the only campaign willing to talk about the revenue side. Look, the reality is in Maryland today, we have a tax code that is too often regressive rather than progressive, and we need progressive tax reform. It should not be that the person who's making over $1 million a year pays a lower tax rate than a teacher or a nurse. It shouldn't be that the large corporation pays a lower tax rate than the small business owner. So we need to fix our tax code. We need to make billionaires and multimillionaires pay their fair share in taxes. A third of the largest corporations in the state paid no taxes in the year before COVID. We need to change our tax policy so that corporations are paying their fair share. If everyone paid their fair share, we'd have plenty of revenue to invest in public transportation, to invest in affordable housing, to invest in childcare. And it's a real distinction between us and the other candidates is the willingness to talk about it. But I'll make this last point. I think part of the reason they won't talk about it is they're scared of the politics. And I think they're misreading the politics. When people see Jeff Bezos launch himself into space in his personal rocket ship, they know something is wrong with how our economy is organized. And I believe Democrats, independents, and Republicans would all agree that we need tax fairness in the state. And so I look forward to nudging, pushing, cajoling, persuading the General Assembly to pursue real tax reform.
Thank you. That's the last of my questions. I look forward to handing it over to my colleagues, and you have the Shore's vote, I'll tell you that.
Thanks, Jared.
So thanks a lot for your answers. We really appreciate that. And you know, as one of those attorneys who works in the eviction court, I volunteered there. We're in a crisis right now. And so I'm going to ask you more about that later on. But I mean, and there's nowhere for them to go. The rents have gone up like 300%. Your rent could go from $1,300 today to 1,900, and there's nothing to prevent that. And so we were just, my colleagues and I were discussing it today. How the hell are we going to do it? So it's not my turn yet. I'll come back to that. But right now, we are fortunate to have Dr. America here, Dr. Sanjeev Sriram, who's a health justice correspondent for WEAC Radio and ACT TV, and also a senior advisor for Social Security Works, a grassroots advocacy organization dedicated to protecting and expanding Social Security, Medicare, and Medicaid. So we're going to get deep now into your brain, John, about healthcare and other things. Take it away, Dr. America.
All right, thank you. Secretary King, I just wanted to say your unwavering support of single-payer healthcare means a lot to doctors like me. We're serving patients and families struggling with the worst aspects of our profit-driven healthcare system. As a governor laying the groundwork for that single-payer care, how do you plan to confront the insurance companies and big pharma? They have a stranglehold right now on Medicaid, and they threaten the basic operations of hospitals and clinics. They make life so much harder for my patients. What will your administration do to fight back?
Yeah, well, such an important question. And I think, look, let me first say, ultimately, I think our goal has to be single payer. We have to get to single payer. I was proud to testify on Delegate Ruth's bill to create a commission in Maryland to chart the way to single payer. It's what all our industrialized peers have done. It is the right way to approach healthcare. That said, in the interim, there are some things that the state could do. One is the state made a mistake in allowing Medicaid to be changed to increase the role of managed care organizations and basically putting a profit-focused managed care organization in between patients and their health care. That was a mistake. We got to reverse that and make sure that the state is paying directly for folks' healthcare and paying the providers, not creating profit for the managed care organizations. On prescription drugs, the state adopted a prescription drug affordability board for public healthcare plans, but doesn't apply to private healthcare plans. So that means that we're not using the full force of the state to control the costs of prescription drugs. We should. That would require expanding the scope of that prescription drug affordability board. We can do that. We need the General Assembly to act on that. And we've got to make sure that we cover folks who are undocumented within Medicaid and the healthcare exchange. Because if you look at the hundreds of thousands of Marylanders who are without health care, a disproportionate share of folks who are undocumented. Immigration status shouldn't determine your ability to access a human right of health care. So those are a few of the things we should do immediately.
Yeah, I really appreciate that because those are the families and patients that I'm taking care of right now. Are a lot of those folks who have gotten the raw end of the deal from managed care organizations, and a lot of people who have had their immigration status used against them when it comes to the human right of healthcare. I really appreciate that. As we all know, the Supreme Court appears ready to overturn Roe v. Wade. I hope I'm wrong, but it appears like they're pretty anti-Roe v. Wade at this point, and numerous states are wrecking access to reproductive health care. What are your plans to make Maryland a sanctuary state for the human right to abortion?
Yeah, well, I'll let Michelle Siri add, because she was the board president of Planned Parenthood before becoming executive director of the Women's Law Center. But I'll say, at a high level, we need a constitutional amendment in Maryland to protect the right to abortion. It's in law now, but we ought to put it into the state constitution so it's harder for a future governor and legislature to undermine that right. We ought to release the funding that was committed to by the General Assembly in this last session that Governor Hogan is preventing that funding should be released for the training of providers, because the truth is, in 2/3 of our counties today, you can't access abortion care. So we need more providers just for Marylanders, not to mention the people who are going to be coming from other states to access abortion. And then we've really got to make sure that Maryland is a North Star for access to abortion and take steps to protect doctors who provide abortion care to folks from other states, and to protect abortion refugees, the people who are coming from other states for care. But Michelle, what would you add?
Sure, I would just add two quick things, John. And one is that we're seeing across the country right now that not only abortion rights, but women who are suffering from miscarriages are also now being investigated and criminally prosecuted as suspected abortion abortionists, basically. And so we need to make sure that we put protections in there for pregnant women across the board. And then the second part is the slippery slope of rights that we know are under attack and certainly at risk once Roe v. Wade is overturned. And that's especially true. I'm the mother of 2 IVF babies. And so, artificial reproductive technology is at risk. IVF is 100% at risk. The hard-won rights of the LGBTQ plus community are at risk. And contraception, when I was the board president of Planned Parenthood, the first thing the CEO said to me was, it's not about abortion, it's about birth control. And so we want to make sure that the whole spectrum of women's reproductive health is protected.
Yeah, I really appreciate that. I mean, what everything's been said. There's also a lot of talk about when it comes to the opioid crisis in our state. And I know there's a lot of ideas out there, but I wanted to focus on the more supposedly controversial harm reduction therapies like needle exchange programs and supervised sites for opioid use. We all know that there's abundant research and evidence from the medical and public health communities saying these particular approaches work, but we've got a lot of work to do to reduce stigma, build that public support. So how do you plan to approach that NIMBY factor among Marylanders, that not in my backyard attitude, but when it comes to expanding harm reduction therapies for our state's opioid crisis?
Yeah, I think we have to make clear to folks that addiction needs treatment, not criminalization. We've had the wrong approach for decades, where we try to punish folks because of their addiction rather than providing them the support they need. This is a problem throughout the state. I've spent a lot of time in Western Maryland, Mountain Maryland, a huge opioid addiction crisis challenge in the western part of the state. Not enough recovery beds, not enough addiction treatment providers. We see similar challenges in our high needs urban communities. So this is a statewide problem of needing to really see this as a public health issue where we invest in treatment. And part of the investment in treatment is harm reduction and having places where people can go to use safely. We know that when those facilities are created, rates of overdose go down, HIV transmission goes down. People are more likely, when they are able to access those sites, they are more likely to seek treatment and to take care of their own health. So this is about a smart public health strategy. I agree with you. There is a sort of a NIMBYism and a kind of a knee-jerk hostility that we've got to overcome. But I think that's partly storytelling and helping people understand that everyone across our society can be affected by addiction. Every family throughout our society can be affected by addiction. And when people, I think, hear from parents their fear about their child who's struggling with addiction and what they're hoping for their child from harm reduction strategies, I think that can help move the conversation, but we need leaders who are willing to have that conversation with the state. Michelle, I know you've tackled these issues in your work at the Women's Law Center. I know what you want to add there.
Yeah, I mean, I think you're touching on it, that it's so very intersectional. The ability of women to seek independence from their abusers, for example, is going to be intertwined with their ability to obtain addiction treatment, mental health treatment, their ability to obtain economic security, their ability to obtain, physical safety. It's all one big circle and one big intersection. And when it comes to mental health treatment and addiction treatment, we're seeing, the same challenges of the shortages of beds. We're seeing folks that were trying to get into treatment centers and being denied because there aren't enough beds, or women who are trying to get that help that they need, but they know because they have small children that they're going to either have to give up their children or get the help that they need. And so we want to make sure that we're taking that full perspective into account when we're supporting these services.
Yeah, my last question is sort of closely related to this, and it's a bit closer to the work that I do as a pediatrician. Right now I'm seeing the highest level of mental illness and distress among children and teenagers that I've seen in my entire career. In addition to your plans to build and strengthen Maryland's mental health care system, I'd like to just hear how you plan to support families with socioeconomic struggles, because those struggles exacerbate the mental illness. It becomes harder to bear that burden and to get through therapy and treatment when you're worried about rent, groceries, utilities, and all the rest. So just to kind of if you could talk a little bit about your plans for mental health care infrastructure and for some of these other supports that my families really need.
Yeah. We really have to see people as whole people. As a teacher, I would try to think about the whole child, right? And all the other systems are impacting kids and families every day. And we see that with healthcare as well, the sort of social determinants of health. And that's true for mental health care. If families don't have healthcare, then it's going to be a struggle for them to access mental health services. And so universal health care is critical to making sure people can access mental health care. We need more providers. We have provider deserts in terms of mental health care. We need to train more providers, particularly diverse providers. So Michelle and I have talked about investing in the training of folks, particularly at our public higher ed institutions like our HBCUs. Get folks to commit to some number of years in communities or roles that are hard to staff, and then take care of the cost of their higher education as an incentive to draw them into the field. We need to make it easier for folks who are trained in other countries, folks who are undocumented, to become mental health service providers if they have the training, immigration status, and where they got their training, as long as it meets the expectations of trained providers here. They should be able to do that. We need their capacity in our healthcare workforce. We also have to tackle the other things that are affecting people's lives: affordable housing, investing in public transportation. In the year before COVID, 80% of kids in Baltimore were late to school. And a lot of that was driven by high school students relying on public buses to get to school. And how stressful is it if your day starts where you're navigating this bus route that is unreliable? You get to school midway through first period and your whole day is now determined by that, right? And so you think about the impact that has on kids over time. You think about childcare. For so many families, figuring out childcare, who's going to do it, how they're going to pay for it, is an obstacle to their health and well-being, and compounds the stresses and mental health challenges they may be facing in their family. So we've got to get to affordable childcare. But this really, it comes down to sort of a holistic vision for how we support kids, families, those who are struggling with health needs. And this is about how the kind of society we want to be. And shouldn't we be a society where we take care of each other?
Absolutely. Agree 100%. And thank you so much for taking your time with these healthcare questions and public health questions, Secretary King. Really appreciate you. I'm going to hand things back to our moderator, Sheila Bryant.
Thank you, Doctor. We appreciate your questions and letting us get inside of Secretary King's head about healthcare. So I'm going to turn it over next to a fellow Hellraiser, activist, and really not just that, a person who wants to see it get done. Both of us have shared that. So Beverly, Beverly John is a member of the Maryland Coalition for Justice and Police Accountability, which is a statewide coalition fighting for police accountability and transparency at the state and local level. She is the president of the Talking Drum Incorporated, a nonprofit focusing on homelessness and criminal justice accountability, and a co-founder of the Concerned Citizens for Bail Reform. So I'm totally interested in hearing what Beverly wants to ask, because we probably have some of the same thoughts flowing through our heads right now.
Thank you, Sheila. Thank you so much. And thank you, Mr. King, for just the opportunity to be able to sit and chat with you a little bit about some of these very, very important issues. I can say that, after listening to the previous questions and conversations, that all of those issues have increased pressure placed upon them by over-policing in communities of color, the trauma that our community members feel because of housing and needing to eat, things like that. It's all more pressure put on it because of the bad policing that we have sometimes in our communities. So your criminal justice agenda, I read, for those who didn't read it, said you would, if you were elected, you would increase investments in community-centric restorative justice programs, which is, yes, very good. Reform the sentencing system somewhat, okay. And you want to build on policing reforms that increase the trust and accountability between the police and the communities they serve, which is really the main topic that, our coalition has been focusing on, for the last year since MPAA, the Maryland Police Accountability Act, was passed in 2021. So you've also talked about in other questions and other responses about the impact of the taxes, the dollars, the budget. Where is this money coming from for these programs? And we all know, it is all about the money. In our coalition, we had a saying, just follow the money and you see where either the answer is or where the problem is, okay? So if elected, could you commit to us tonight to increasing our local, working to increase our local budget so that we can accomplish these goals within our communities, and to not increase the police budgets as some are prone to do, whenever there's an increase in crime, which we know there is crime and we need to address that, but we know that more policing is not necessarily the answer to it. So can we get some, how do you feel about answering that question? Can you commit to really putting the money where it needs to go?
Yeah, I'm so glad you raised this. And this has been one of the most frustrating parts of the conversation amongst the Democratic candidates over this campaign. You've heard candidates sounding a lot like Larry Hogan. Larry Hogan a few months ago did this refund the police initiative, which was a lie. There's no community in Maryland that's defunded the police. Police budgets have gone up across the board, including in Baltimore, which is where he focused a lot of his negativity. The police budget has gone up quite a bit. In fact, Baltimore is number 3 or 4 in the country in per capita policing, the number of police officers per citizen, right? If policing alone was enough to solve public safety, we wouldn't have a problem, but it's not enough. And so I hope folks will take a look at our One Baltimore plan that we just put out. And it's instructive about our vision for public safety, and it really applies throughout the state. We need a strategy that is beyond policing. Yes, there's a role for police in stopping the flow of illegal guns and investigating violent crimes. They need to protect folks' civil rights as they do that. But then we need so much more. We need investments in mental health services and addiction treatment. We need investments in reentry programs. 95% of the folks who are incarcerated are coming home. It's better for everybody if folks can get education and job training while incarcerated and then get support finding a job and housing when they come home. We need violence prevention programs like Safe Streets that are doing violence interruption work to break cycles of violence. We need rec centers. You know what we've defunded as a society? Rec centers and after school programs and summer jobs for teens. And so when we don't have those, kids are much more likely to get into trouble. We need apprenticeship programs for young people who are disconnected from school and work to help them find a path to economic opportunity. If we do all of those things, we can get progress towards public safety. But I hear a lot of my opponents, sounding like the mid 90s, send in more police, treat the issues that we're seeing as an excuse to go back to the policies of mass incarceration. And that to me is exactly the wrong direction. So know that Michelle and I are committed to a vision of public safety that is holistic and not just a rehash of the policies of the 90s.
Well, thank you so much for that response. And we look forward to our next governor, you being able to fulfill your goals in that area. I have one more question, and it's regarding specifically in across the state. You know that all of the counties are in whatever process of trying to implement these police accountability boards based on the legislation. We've all various forms of challenges, strong opposition, and it appears to be, serious opposition from the Fraternal Order of Police. At our local levels, they are really pushing for amendments that the community has proposed to help make these bills stronger, and that would help increase the trust and the transparency that we're seeking, with our local law enforcement. You mentioned earlier that, there's corporations that are not paying their fair share of taxes, but I believe they are influencing our legislation. So as governor, how would you respond to that kind of pressure? Because again, it's just all about the money. Yeah. There's money that's influencing all of this, and the community is getting the short end of the stick. So how would you as governor try to help eradicate or get that out the way?
Yeah. Well, look, this is another example of where I think the General Assembly needs a partner, but also a push. Folks in the General Assembly, when they passed policing reform, which, was an important step, they said if at the local level there were struggles around implementation, that they would be open to strengthening the law to make sure that we get to the protection of folks' civil rights. And, certainly I've lived interactions with police officers where I felt like my civil rights were violated. I've worried as a parent and as an uncle and a cousin about young people in my family and their interactions with police officers. We need to have a strong accountability system, and to the extent that the law has created loopholes where folks can delay implementation, we've got to change the law. I think about what happened today in the Supreme Court. The Supreme Court saying that no longer will it be seen as a federal civil rights violation for an officer to fail to read the Miranda rights. Basically remove the ability of citizens to sue when their Miranda rights have not been given to them. This is horrendous. Yeah. So we've got to look at in Maryland, how do we make sure we protect those civil rights? I've been an advocate for getting rid of qualified immunity. If you're a police officer and you violate someone's civil rights, you should be accountable for that. And, folks have argued with me and said, well, the job of a police officer is complicated. And I understand that. But the job of a doctor is complicated. The job of a lawyer is complicated. And they are accountable and can be sued for malpractice if they don't do their job right. And we need that same approach around policing.
I agree. Thank you so much for your responses.
Thank you.
I'll pass it back to Ms. Sheila Bryant.
Thanks so much, Beverly, for your really great questions. I appreciate that. And I also appreciate the answers. So one of the things that we want to talk about, I want to follow up on another issue that came out from the Supreme Court today with regard to lifting the ban so that it's no longer, shooting down the ban on New York's concealed carry law. I mean, where do we go from here? It's like there's a plethora of guns in our community already. We just saw what happened in Uvalde. We see every day that there are more and more guns on the street, and here we are, you know, with the Supreme Court saying, yeah, it's great. Let's bring more guns. In fact, let's put them in the schools. What are your views on that? And how do we keep ghost guns and all of these weapons out of the hands of our sons, out of the hands of our children, out of the hands of people who would do us harm?
No, I'm so glad that you raised this. You know, I'll share last week. You know, I was in the campaign office and I looked down at my phone. I had a text from my daughter to my wife and me saying that she was in her classroom hiding under a table, and that someone had a gun and she was scared and she just wanted us to know where she was. And I talked to my wife, who was crying, and we went to the school. I don't know what we thought we could accomplish, but we just drove to the school because we felt like we just needed to be there. It turned out there had been someone outside of the school who'd seen someone with a gun. They'd reported it. They put the school on lockdown. Kids didn't know. They were just hiding and scared. This is crazy that we've allowed this to happen as a society. No other country has this. And it's because of the guns. It's the guns. That is the distinction between us and other countries. We don't have more mental health issues than other countries. It's the guns. And we need much stronger gun laws as a country. You know, Chris Murphy, the senator from Connecticut, won this hard-fought, modest progress in the Senate. And then you see the Supreme Court essentially saying, in New York, if you want to walk around with a handgun, that's fine. And this is so reckless and so dangerous. So we've got to make sure, and I know Brian Frosch is looking at this, we've got to make sure that we make whatever change we need to Maryland law to try to maintain Maryland's protection against the concealed carry of handguns. We have an assault weapons ban. We have to make sure we protect that. We have a red flag law we should strengthen. We do not have strong enough, I believe, laws in Maryland on child access prevention, holding gun owners accountable for when children get access to weapons. We ought to look at strengthening our storage laws so that we keep guns safely stored in the state. But ultimately, this really needs federal change, and we need to elect people who prioritize the safety of our kids rather than the agenda of the NRA. And we need to elect them at every level. We need to get rid of Andy Harris in the 1st Congressional District, who is on the side of the NRA, not on the side of our kids. We need to make sure that we have a Senate that is ready to set aside the filibuster and pass laws that protect our kids. There's just no words to describe how infuriating it is that 10 years after Sandy Hook, we have Uvalde, and then we have a Supreme Court that's going to make it easier for people to get weapons to hurt children. It's just insane.
I totally agree with you. And, you know, we really, I mean, I hope that you can use whatever, you know, your connections and power and authority, and just your passion to try to work towards that end. But specifically, you know, with the ghost guns and making sure that Maryland has very strong protection, because I think I read the other day, a 13-year-old had a ghost gun and took it to school with him. It's now okay in his waistband. So, I mean, that's a huge thing. Now I'm going to switch gears a little bit because on the one hand, we have, you know, the plethora of guns, but on the other hand, we have people who've been to prison and they've done their debt to society. They've been in prison for years and years and years with absolutely no preparation for getting out.
Yeah.
So you go to prison and you don't have education, you don't learn a skill, you don't have any rehabilitation. then we kick you out, the government kicks you out of jail and they say, okay, bye, you're done. No money, no job, no housing. It's like, what are your views on how we can protect our returning citizens and let them know that, yeah, you did something bad. Now you've paid your debt. How do you welcome them back? What are your ideas about welcoming them back into our society?
Yeah. Look, I think we need to radically rethink our approach to incarceration as a country. When I was Secretary of Education, one of the projects that President Obama and I worked on was restoring access to Pell Grants for folks who are incarcerated. And this was because in the mid-90s, in the 94 crime bill, which had many terrible components to it, one of those terrible components was banning Pell Grants, the federal assistance for higher education, for folks who are incarcerated. And so college programs in prisons all over the country closed overnight. A few stayed open with philanthropy, but many, many of them closed. I talked to one woman who was incarcerated at the time who said that the guards came and took the books out of the library and said, oh, you're not going to need these anymore. This was part of the like tough on crime craze of the mid-90s. So we wanted Congress to repeal that ban. We had a Republican Congress that wasn't willing to do that. So we used our authority under the Higher Education Act to create a pilot program, 65 colleges and universities where folks could use Pell Grants while incarcerated. And then we use those pilot programs to move the conversation with Congress and governors. And actually in December 20, finally got the federal law changed. So Pell Grant access will be restored for folks who are incarcerated. So I'm really proud of that work. Work that we started in the Obama administration that I continued as a civil rights leader. And one of the things I was struck by in visiting programs is folks would say, for some of the folks who were incarcerated, their college program in prison was the first time they felt like they got real educational opportunity. Folks would talk about how it changed their relationship with their family because, as one man said to me, it gave him moral authority for the first time with his family because his kids saw him working on his education while incarcerated. We need a lot more of that. Job training, educational programs. We have many folks who are incarcerated, sadly, who struggle with basic literacy. We need more literacy programs to help folks get the skills they need. Drug treatment and mental health services, mediation programs to help folks work out conflicts with their family members so that they're able to return in a better place when they come home. And then we need programs to help people find jobs, find housing. We have to get rid of collateral consequences. All over the country, we have these ridiculous laws that say, well, if you've been incarcerated, you can't, and then just a series of things you can't get housing, you can't get this kind of job, you can't get this kind of license, so forth. We have to roll back those collateral consequences so that folks have real opportunity. And this will be better for public safety, right? Because if people come home and they can't do anything, then they end up right back in the situations that got them incarcerated in the first place. And so
it's amazing that people don't recognize that.
Exactly.
Like, you don't give me any of the skills, any of the opportunities, any of the tools and resources. What am I supposed to do?
Exactly.
So
Exactly.
I really appreciate that. That's a huge issue. And, being a member, a retired Marine, I understand the concept of compound trauma that, yes, it happens to you. A lot of people, in fact, who are in the military are in prison because of the mental health issues that they have, that they go into prison with. If you look at the stats, you'll see most people who are in prison have had, it was related to drugs or alcohol, or it was mental illness, immediate mental breaks, or some long-term mental health issue. So I think that we're not really placing enough emphasis. And I heard you speak about it earlier on the shortage that we have of mental health providers in this county. We really have to do something to encourage more young people to go into that area of psychology and counseling and that kind of thing to sort of meet the need.
That's
so
right.
do you have any idea how we could draw them in?
Yeah. Well, a few things. I mean, one is, I think we need more programs at our HBCUs in particular, because we need to diversify the mental health profession, school counselors included in that. We need a lot more diversity there. Our HBCUs can be a powerful pipeline. Community colleges, a disproportionate share of folks of color start their higher education experience in community colleges. We should make community college tuition free in the state. And then we should help folks in community college get into programs and internships that will then lead them to move on to four-year institutions to pursue degrees in mental health services and addiction treatment, right? We should act like this is an urgent need, because it is, and help people get the higher education to be able to access those professions. We need a lot more bilingual folks to enter mental health services and addiction treatment. We need a lot more work on cultural competency for folks who are entering those fields. But that's a matter of the state investing in our public higher education system to make that possible. And then, of course, if we had universal health care, it would be easier to make sure that folks who choose the mental health services field can get, can pursue that in every region of the state, because we have a shortage of providers, especially in some of our rural areas, and investing in universal health care will help it be possible to have better mental health service infrastructure in those parts of the state.
Wow, John, it seems like you want to build a state that actually cares about the people. That's amazing. Thank you so very much for all of your comments. And I'm sure we've really given our audience a lot to think about and reasons to vote for you. So I appreciate your time. You and Michelle, thank you for joining us.
Thank you for just a wonderful conversation.
Yeah, it felt really good to just have the conversation, and we got to hear, your in-depth views personally. So thanks a lot.
Thanks.
Carlos?
Awesome. I mean, it took me a minute to come off of mute. I'm just so amazed. I mean, just hearing a solid progressive candidate for governor, something that we have not heard in a long time, a lot of things that have been silenced for a long time. I am so just honored that you were able to take this time out of your day to come and speak with us, that we were able to hear about your platform and just hear the ways that you plan to move Maryland forward. If you want to real quick, just tell people how they can support your campaign, how they can help out, anything at all.
Absolutely. Well, thanks, Carlos. I mean, a few things. One is I hope people will help us with door knocking. Carlos and I were out door knocking the other day, with door knocking, with text banking, with phone banking, putting up yard signs. So folks go to johnkingforgovernor.com. They can sign up to volunteer. Obviously, contributions matter. We're trying to get our message out everywhere. So contributing is certainly helpful. And then really helping us build a movement. I mean, we got to get Carlos elected. We got to make sure that we are electing progressives up and down the ballot. And so this is not about one race. This is about all of our races together, helping us move the state in a more progressive direction. So I hope folks will go to johnkingforgovernor.com. Follow us on Twitter at John B. King. And I look forward to winning in July, and then winning in November, and then coming to Annapolis with a mandate for progressive change in January.
There we go. I mean, that's the way you do it. And yes, if you could put your link in the chat too, so people can go ahead and make sure that they click the donate button, click the button to get a yard sign, phone bank, canvas, and all of that. Again, and I'll leave it to Sheila. Any last comments just for John King?
No, I'm just glad to be part of the team, So thanks a lot for showing up and for letting us know what's real, We really appreciate it. I think you've convinced a lot of people why you should be governor. So thank you so much.
Yes, thank you so much, Secretary King.
Thanks so
we
much.
look forward to seeing you in the governor's house. Thank you so much. Chrissy, you want to go ahead and say a few words before we close out as our chair?
Okay. Hi, everybody. John, thank you so much for joining us tonight, but let's let him go. He's going to jump over to the Sunrise Movement Maryland Zoom right now on Facebook to talk about his environmental policy. So join John next live, and please, I put the link to help support him at johnkingforgovernor.com. Thanks, John.
Thank you so much. Take care.
Bye-bye.
Thank you all so much. Have a wonderful, wonderful. Also, have a wonderful, wonderful rest of your day. This was so amazing. Thank you, Beverly.
That was good. That was
Thank you,
good.
Sheila.
Yes.
Thanks, Beverly.
Okay, guys, have a good one.
Enjoy.
I'm gonna raise some hell.
Yeah, so join the campaign, everybody. We are canvassing on Saturdays. Hosted a meet and greet event in your neighborhood. Let's put a sign out. We got to get all of our signs out. We need phone banking support, texting support. So our revolution, Maryland, will be sending constant emails and tweets and inviting you to come on in, and let's do some phone banking for our revolution endorsed candidates up and down the ballot, as John said. So, very productive phone calls. We've endorsed a lot of progressives. Let's get them